I'm Jill Generelli. I'm an RN and I work for Meridian Cancer Care at Bayshore Community Hospital in Homedale. I went to the nursing program at Brookdale. Directly out of Brookdale, I went to Monmouth University to get my BSN because that was always my goal. And then I had gone back after getting married and having a few children, and I got my master's in nursing. I've been a nurse for 17 years. I decided to become a nurse as a little girl. I had some chronic kidney problems myself, so I was at the doctor pretty frequently and had been hospitalized a couple times. And as a little girl, I was in awe of nurses and what they did, and that was my dream. Nurse navigation is it's just such a great concept in healthcare today because medicines come so specialized. There's a specialist for every condition, every problem. And I think to have that one common person who can help, facilitate and help you get to the next step. It's a service that Meridian provides to, offers to these patients to help them make the path a little bit easier, or to remove some of the stress and fears that they have. So, to the community, I think I feel that why would you not call the Nurse Navigator to ask for assistance in any way? And it may just be for emotional support, or it may be, something, more than that, financial or insurance issues, or helping with the doctor's appointment. But these are all the things that the Nurse Navigator can do, and it's a service that's waiting for the patient to call. Every day I go to the lab and I get the positive pathology report, or I get all pathology, and once I find out the patient has cancer, I call the physician to make sure that it's okay. And most physicians have already given me the okay to call the patient. I'll give them a call and say, hi, my name is Jill. I'm the navigator here at Bayshore. I see that you had a procedure done. Is there anything I can do, or how can I help you? And a lot of times you hear that sigh of relief, or you get that feeling that they're so excited to talk to somebody. They've probably been dwelling on this for 24, 48 hours, and now there's somebody calling, reaching out, saying, how can I help? So then they start to tell me their story, and I listen, and I try to find out what can I do next to help you? How can we get that, the next step to your journey accomplished? And it's maybe setting up a doctor's appointment because they're just too nervous, or they don't know the phone number, they don't want to, they can't really find the next step. It's rare that I have a patient that says, I'm okay, I don't really want your help. A lot of them really just want to talk. I had a patient yesterday I spoke to, and she's a nervous wreck because she has to go for an MRI next week, and she's never had one, but she's heard all these horrible stories about them, and she's claustrophobic and she doesn't like darkness. And I said, can I meet you downstairs and just be there with you? And she was like, well, you would do that? You don't have time to do that. And I said, no, I'll come downstairs. So I'm going to meet her next week, and I've never met her before, but just the phone call, and she was just happy to have a voice to talk to and just discuss her fears. I think for patients, being told that they have cancer is just probably the most overwhelming thing they could be told, the most difficult time in their life. It's important for me to help them, to be here as a resource for them, for their families, and just to help them to the next step.